Hi, Dr. Smith. This is Lindsay, a student nurse from UK. I'm calling to talk about one of your patients, Miss Smith. She's in room 223. She was admitted for AROM due to having uncontrollable preeclampsia. She's had preeclampsia since about her 16-week mark. As you know, she's a G1P0 and she's 35 and 2/7 weeks. As you know, she's a 25-year-old Caucasian female with a history of obesity and hypertension. I just took her vitals and her blood pressure is running a little high. It's 130/82, but the rest of her vital signs were pretty normal. She's currently taking her lisinopril at 25 milligrams, so that's helping a little bit. And she has an 18 gauge IV in her right hand, and I have her on Pitocin running at 6 millunits per minute, and she's on magnesium sulfate at a maintenance dose of 2 grams per hour. My issue right now that I'm having is that I checked her deep tendon reflexes and they are 1+, and about 2 hours ago, they were a 2+. So, that's changed in, that time period, and she's also feeling a little dizzy. I noticed this with her when she asked if she could use the restroom, and I assisted her to the restroom. She had to take a little pause because she stated that she's been feeling a little dizzy. I looked at UK's protocol for magnesium, and it says to contact the healthcare provider if the patient has any of these symptoms, with the patient reporting dizziness or blurred vision, and if the deep tendon reflexes become decreased. So I just wanted to let you know about that. So my recommendation is that I wanted to, and I also see in the protocol that the maintenance dose should be at 2 grams an hour. But my recommendation that I wanted to consult you about is that I wanted to know if we could lower her maintenance dose to about 1 or 1.5 grams per hour. I have looked up several studies on PubMed in the last 5 years, and it shows in the 3 articles that I read about, it shows that women with preeclampsia did just as well with a maintenance dose of 1 to 1.5 grams per hour, or extending the 2 grams to a longer time period, such as over 2 hours. This worked just as well as the maintenance dose of 2 grams per hour in preventing eclampsia, and women had much fewer side effects from the magnesium sulfate. So I was wondering if this protocol could be looked at or added on to with the UK's protocol, or if we could possibly add something to it. I was just wondering if this could even be possible, and if you could please consider this or look at this, because right now Miss Williams is feeling some mild discomfort, and I don't want her to have the side effects from the Pitocin, but I also don't want her to have these side effects or get worse. I don't want the magnesium sulfate side effects to get worse and it turns into affecting her respiratory rate, or having anuria and stuff like that. So if you could please come down here and assist me with this, that would be great. Thank you for your time.